through ADHD and how it impacts adults.
Yeah. So that's a very good question. So ADHD, I kind of give the example of think of a radio frequency, like you're listening to the radio and there's one station on. ADHD would be like if multiple radio stations are playing and you're trying to focus on the first or the one signal that's coming through the radio, hearing that noise. ADHD is difficulty filtering between what you're supposed to be focusing on. So it's related to what's called your executive functioning. Part of your prefrontal cortex, that front part of your brain, kind of acts as a organization center almost for you. It's responsible for organizing, focusing, executing tasks. And what happens with ADHD is it has difficulty filtering some of that information through. And so you're paying attention to too many things instead of paying attention to that one thing you're supposed to be focused on, whether that's reading, writing, or all the above. How that looks differently in adults versus children, and we assess both here. Adults are going to be what we call more internalized versus externalized. So a kiddo in a classroom, they might stand up and run around and have that hyperactivity that you hear in the ADHD name. As an adult, likelihood of you standing up and running around in your workplace is very, very little. Those symptoms are going to be more internalized, meaning we feel a heightened level of arousal or stress inside of us. If you look at the symptoms of ADHD, hyperactivity, okay, so that might be like shaking my leg, or I'm fidgeting, or I'm tapping. Impulsivity, so maybe I'm interrupting others, and at the same time, hyperactivity and inattention, obviously, as well. So those things are going to look a little bit different in children and adults, where adults are going to be more likely to internalize those symptoms of having difficulty staying attention, focusing on tasks, versus children might act out more behaviorally.
So then how is it different in any way, diagnosing ADHD for adults versus kids? Because it sounds like from the way you put it, that might be more difficult to diagnose in adults.
It is a little bit difficult to diagnose both in children and adults, actually. So how we go about diagnosing this, and this is my big thing with ADHD, the rate of diagnosis is increasing, but it's increasing because I think we as providers need to do a better job of not saying, okay, does inattention exist or not? We need to say, does inattention exist, and what is driving that inattention? So I'll start with adults here because that's kind of what we're talking about today. We do a full comprehensive evaluation because there's a lot of life factor things that can look exactly like ADHD. So for example, let's take the symptoms of anxiety. There's restlessness, there's irritability, there's difficulty with concentration. That sounds a lot like the symptoms I listed for ADHD of hyperactivity, impulsivity, and the rest of them. So there's a lot of overlap between those symptoms. So what my job as a psychologist is to do is sit down and gather a comprehensive picture of people. Not only how they're doing at their workplace, executing tasks, but also how you feel about yourself, what's going on in your home environment. Those are all things that are very important to consider before we kind of just throw this ADHD label onto an adult.
Do you feel like this is something that adults should be tested for?
Absolutely, 100%, 100%. Well, I think right now, kind of our diagnostic tools, what you might see going into your primary care provider's office, and please don't say I'm taking shots at the primary care providers, but what you might see is simple self-report scales, which are very important. But also at the same time, we need objective data as well. So one of the things I mentioned, intellectual functioning tests earlier. I want to see what your working memory is like, how well you remember information, what your processing speed is like, exactly what it sounds like, how quickly you can process visual information, auditory information, how well you can retain those things. And we use objective testing to help evaluate, okay, are we experiencing neurodevelopmental concerns here, where we have deficits in memory or we have deficits in other areas, versus are we functioning kind of on all cylinders in those areas, but we're experiencing that heightened sense of arousal, we're experiencing that increased level of stress. That could be better explained by anxiety or trauma or some of those other things that are going on in individuals' lives. So when I sit down and I do an evaluation with people, it's not just, hey, let's take this test and see. It's, hey, tell me about yourself. Where'd you grow up? What are your relationships like? How do you feel about yourself? You get into really intimate details with person because you need to know the whole person before we can understand why you might be functioning or feeling the certain type of way that you do.
Say someone is diagnosed with ADHD. Is that something that they should let define themselves, or not so much?
Well, what do you mean by define themselves?
Like, should they, go around, oh, I'm worrying that now I have ADHD, I've been diagnosed, my life is ruined, stuff like that.
Well, that's a good question, and it depends on how you look at it. So diagnostic labels can sometimes be a stigma for people. And I've had people in here that struggle with getting the label of ADHD or anxiety or autism or some of these other diagnoses that are commonly thrown out by psychologists. But on the other hand, sometimes it can be very relieving for people, that people have an understanding of how they feel, but they can't put words to it, they can't put a name to it, and they struggle with, is something wrong with me? Is there something going on with me? And they don't know until they come here or they come somewhere else and they get a evaluation done. And we can say, hey, what you're experiencing is something that's normalized that many other people experience too. It can actually cause some relief for people once we put a game plan together for them about how they can move forward kind of with this diagnostic label. So what I tell people all the time is, ADHD or any diagnosis, the goal is to not put you in a box. It's not to put this label on you. It is simply a way for us to assess, hey, where are our strong areas? Where are we firing on all cylinders, looking really, really good? And where are some of our growth areas too? And sometimes if you look at those patterns of growth and strengths, it's gonna fall under that criteria of ADHD.
You sort of talk about the rise in cases you've been witnessing. Do you feel there's been a specific rise among adults in your experience with ADHD?
I think the rise of ADHD in general with adults and kids is happening. And I think one of the reasons that is because of our diagnostic tools, and I go back to why it's important to be assessed. So for example, with adults, okay, you might have somebody who is extremely social, very extroverted, or somebody who might be very disagreeable and may not always want to get along. That can also look like hyperactivity. If I'm like, no, I'm gonna do my own thing, or if I'm like, hey, I wanna meet you and be all around. Well, that could just be related to some of the 5 factors of personality that we see. That doesn't necessarily mean that it is meets the criteria for pathology or that it's a detriment to your personal functioning, your occupational functioning, your social functioning. So again, I think kind of the rise in ADHD diagnosis is because it's kind of this all-encompassing label that we can say, okay, you experience inattention, we can very quickly kind of fit you into a box. But sometimes that label doesn't tell the full story of what might be going on if you have a history of trauma, if you have a history of anxiety. And I think what you're seeing with the rate of diagnoses rising with both children and adults has a lot to do with how we go about providing those diagnoses. And that's why I go back to, again, it's not whether inattention exists or not, it's what is driving that inattention. And that's what we work to solve in this office.